Mills Campus, Cambodia. This time around, we're in the skills lab, and when I talk about the skills lab, we are talking about the medical values, medicine, hospital, health, whatever. And here with me is Dr. Naziru Rashid, who is the university medical officer, Islamic University in Uganda medical officer. So we are going to talk about very many things today, and in our topic today, we're going to talk about obesity, actually weight gain, metabolic diseases, and when I was discussing with the doctor, he told me that those are called non-communicable diseases. You're welcome to connect with Baligi Afan, and please introduce yourself to the audience so that we can go ahead with our program.
Thank you very much.
You're welcome.
To our viewers, Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
I'm glad to be here today. I'm going to be sharing with our viewers on a very important topic of non-communicable diseases.
I thought I'd...
No. You mentioned it very well.
Okay.
Very well. Yes.
I don't want to temper with medical terms. Okay. Dr. Naziru, you know, we've been in a very long period, and even some other people are still home in the pandemic corona period.
Yes.
And many people are complaining, you know, when you visit social media, of weight gain. Others are becoming obese.
And you are stopped from exercising.
Exactly. So I want us to take a look at the burden, how heavy this is, what causes this, and maybe even giving us the solutions, but you can really enlighten us about this kind of a problem that we are facing during the corona period.
Thank you very much once again.
Especially ladies.
Yes, this is very timely and it is indeed very, very important given the fact that globally the attention has been so much on what we would call communicable diseases. Communicable diseases, and this other side of non-communicable diseases has been somehow neglected. That's why we thought that today I think we should share with our viewers about this other would be neglected in the current period problem. As he mentioned, non-communicable diseases, this refers to the diseases that are not transmittable from one person to another. The diseases that cannot
acquire them yourself.
You acquire them yourself. They are not transmitted from
one person
from
to
me
another.
to you, for instance.
Hey.
That is one of the aspects of non-communicable diseases. Secondly, they don't have what we would call infectious agents, or the bacteria or viruses or parasites that would attribute that this is the one that is causing that particular disease.
Okay.
The way you would say coronavirus causes COVID-19, Plasmodium causes malaria, so on and so forth. These category of diseases, they don't have those infectious agents that would cause them.
Okay.
And lastly, we cannot acquire them by being with other people in the same vicinity.
Okay.
That's why we are calling them non-communicable diseases.
Meaning the opposite is
the opposite is the other one that can be transmitted from one person to another, but that also have infectious agents that cause them.
Okay.
Yes.
Now we are very clear on that. So, can we start with the causes? I mean, because we need to know what really causes this. But
what brings it about?
What brings it about? Before we take a look at the burden.
Okay. We find that these diseases, much as they are not being paid attention so much like other infectious diseases, we find that when you look at the World Health Organization statistics, the burden is about 46% of the disease burden, and 46%, it means they are almost hitting the 50-50 mark.
Just 4?
Yes.
4 to 50?
Yes, and it is estimated that they cause about 35 million deaths globally.
Is this a serious problem?
Very, very serious, and about 75% of the 35 million deaths is expected to be in developing, that is the low and the middle income countries. What is special about this disease is that in the past, we used to think that these are diseases of the rich people.
Yeah.
But
they eat junk.
yes. But with advancing technology, information, people are well informed about dietary, they do everything. We are seeing a shift from the would-be infectious diseases, the one we would call diseases of the poor, of the low socioeconomic class, from those infectious diseases to non-infectious diseases or non-communicable diseases. Again, this is simple because, for instance, if we use the current situation where people have been informed about the importance of hand washing, the importance of hygiene, the importance of proper disposal of waste, proper disposal of even human waste, you find that we are trying to control not only COVID-19, but even other diseases that we would get from unhygienic conditions, including typhoid and so on and so forth.
Especially in places where low-profile people are found.
Exactly. So once I wash my hands with soap and water, I am not only preventing COVID-19,
You're
but
preventing
even other diseases that I would get from that kind of transmission. So
true.
because of that kind of information and advance in technology, that's why we are shifting now from those kind of diseases to the non-communicable diseases. As you asked, I told you that there are no specific causes like bacteria and viruses and so on, but the main risk factors for this kind of diseases is just from an individual's lifestyle.
How you associate with your food,
with
how you
yourself.
associate with your health, yourself.
Yes, and there are about 4 major factors. The first one is diet.
Diet.
Yes.
Okay.
Still in the past, we used to have high cases of diseases that are due to undernutrition.
Marasmus.
The kwashiorkor, the marasmus, and so on. And this used to cause a lot of challenges, especially in developing countries. However, like for example in Uganda, there's a lot of food and so on and so forth. We have shifted from that side to overnutrition.
Oh, the curve has changed, has shifted.
Yes, from undernutrition to overnutrition. And this is one of the contributing factors to the development of non-communicable diseases, as we are going to see. Number 2, we call that one unhealthy diet.
Unhealthy diet.
Yes. Okay. Number 2 is the inactivity, being inactive. In addition to eating a lot, you don't utilize that food. I would use an example of food being fuel. You are taking in a lot of fuel that you would use to provide you energy to do a number of activities. But given still due to our current lifestyle, I will put in a lot. If I'm a worker, I'll go and sit in my office for maybe 4, 5, 6 hours. After work, I sit in my car, drive back home, and the story continues.
Yeah, so the things of telling us that maybe after eating, relax. So that food can what? I don't know, it can move. I don't know. The local stereotype.
I'm going to come back to that slightly later.
Okay.
That is number 2, being inactive. You are eating, but you are not utilizing the food you are eating. Number 3, other lifestyle, smoking.
Oh.
Smoking is one of the contributing factors to the development of non-communicable diseases, and it is responsible for a number of cancers that you are going to see. And the last one, but not least, is the excessive consumption of alcohol.
Oh, excessive consumption of alcohol.
Yes.
Oh, sicko.
So you'll find that even in the low-income earners, the ones who would think that maybe they will not get that too much food to eat and so on and so forth, the little money they earn, the biggest percentage of their earning is spent on smoking and alcohol. So they are also not spared within the category of the non-communicable.
They have joined the wagon.
Exactly. So going back to dieting, you'll find that the body requires a particular amount of energy, which helps you to carry out a number of activities. So it is expected that once you eat, you utilize that food to do those activities. If that doesn't happen, the body is organized in such a way that it is supposed to store the excess of that food.
Excess food?
Yes.
So you mean the body has the percentage of food it must acquire?
It requires, yes.
Okay.
And that excess food, which in most of the times is in form of glucose, that is obtained from a number of foods, from carbohydrates.
Okay.
And you understand that most of us, we depend mostly on carbohydrate-rich foods.
You mean posho, potatoes, rice,
chapati, rice, pilau, sweet potatoes, pilau. I know you people, you like pilau so much.
And you have MC pilau on the camera there. It's called MC pilau.
Exactly. So that pilau, once it reaches into the body, it is broken down into a form of a nutrient called glucose. That glucose is the fuel that our body needs to carry out particular activities, all the activities, including talking like we are doing now. Now, if you don't utilize that glucose, the body is supposed to store it to be utilized at a later time. And the form of storage is usually in form of fats.
Oh.
Yes, and those fats, they are deposited in a number of places within our bodies. But for today's show, most importantly, those fats are deposited inside our blood vessels.
In Uganda, it's called emisiwa.
Kati amasavu ago gagenda negetereka mu misuwa. Kati mu misuwa egyo mubaamu ekkubo nga bwe wandiraby akaseke ka soda, like a straw. Kati when fats deposit themselves inside that the vessels, it means that they are reducing that gap inside the lumen. Ekifo ebbanga omusayi we gulina okuyita. So when that gap reduces, it means that the heart, which is supposed to be pushing blood through those blood vessels to supply different parts of the body, is going to use a lot of energy.
To push the blood.
To push the blood. So blood is going to flow within those blood vessels whose size has been reduced because of deposition of fats. And that's what brings about high blood pressure. And that is one of our non-communicable
diseases. Is this the pressure that I hear of locally, that someone has pressure?
Exactly. It means that blood is flowing within the blood vessels with tension. At a higher force than it would be under normal circumstances. But as we have seen, it has come about as a result of reduction in the size of our blood vessels because of the deposition of the fats. That is one of our conditions, high blood pressure.
High blood pressure.
Yeah, and it does not end there. When this heart continues to push that blood with force, the heart muscles, they start becoming weak. And after becoming weak, because the work has been increased, because of that increased work,
there is a lot of energy.
Yes. So the heart muscles tend to increase in size, a condition we call cardiomegaly. But because of that reduction in energy and so on, now it has also affected your heart already because of the high blood pressure and the blood vessels. So the heart becomes weak, and at a particular point, it may not be in a position to continue pushing that blood.
It becomes very weak. Blood cannot even flow.
That is one. Two, these blood vessels, they supply very many parts of the body. But for today's show, we can talk about two of them. One of them is the heart itself. The smaller blood vessels that supply the heart, once they get those deposits of fats, there are two possible occurrences that may occur. The first one is that because of the reduction, the heart itself may not get enough blood. When it doesn't get enough blood, remember
the heart must have. I didn't know.
The heart is also functioning.
The source.
Yes.
You.
The heart is also functioning. Therefore, it requires energy to do also to do its work of functioning. And that energy is got from food, from oxygen, which is also supplied by blood. So when those small blood vessels supplying the heart are also reduced in size, they may supply a little blood to the heart. That also contributes to the weakening of the heart because it is not getting enough supply of oxygen, of nutrients, and so on. That is one. Two, those small blood vessels supplying the heart, they may be occluded, they may be obstructed. The fat deposit may prevent blood from reaching those muscles
of the heart.
Yes. Those conditions, we call them coronary artery diseases. The coronary artery diseases, the coronary arteries, those are the blood vessels supplying the heart muscles. So when they can no longer supply the heart, it means that the heart will stop functioning. And once the heart stops functioning, what do you expect?
You die.
Tiyafudde kikutuko munnange.
Cheche chikutu.
Abadde mulamu ng'atambula bulungi naye n'alwalako katono bageze omutuusa mu ddwaliro ng'afudde. Sometimes maybe because of our poor eating.
These are some of the things we should really put focus on, because we need to understand our health values.
Exactly. So another organ, I said we are going to talk about only 2 organs, is the brain. So when the blood vessels that are supplying the brain, their sizes has been reduced by the deposits of those fats, it means there is a particular part of the brain that may either fail to receive the supply of oxygen and nutrients in the blood because the blood vessel supplying that part has been blocked by the deposition of fats. So when that happens, kitegeeza nti pati y'obwongo eyo egenda kulekera okufunctioninga.
Yeroza
jukira obwongo bukola milimo mingi naye ng'egiri common ze zituyambako okwogera, okukwata, okutambula. Kati eyo party that is responsible maybe for this right hand side of mine, webanga stop in okukola, the whole of this side will stop functioning.
Kuba ito paralyzing.
Ebera paralyzed. So when it becomes paralyzed, batugamba nti ate oli stroke yamukubye, yabadde ne pressure mungi, stroke nemukuba. So kiva ku ekyo. Okitegeera? So that is what happens. But it has come about because of poor eating habits. Not because you don't have food, but because we are eating a lot of food than our body requires and we are not utilizing it.
Utilizing meaning
we are not exercising.
Okay.
Yes. So that is one possibility in the brain. Another possibility is because we said that the blood is moving at a higher speed and a higher force within our small blood vessels. Those small blood vessels obusuwa obutono obusupplying a party yonna eyo y'obwongo busobola okwabika due to pressure
kubanga buba butono.
Exactly. Kati bwe bwabika that part of the brain efuna kyetwandise intracranial hemorrhage, efuna omusaayi gugenda ku bwongo,
ofuna hemorrhage ku bwongo.
Kati ofuna hemorrhage ku bwongo era kisobola okuleetera stroke oba okubeera paralyzed. Naye nga tulabye nti kivuddewa
ku mmere eno gye neefumbidde obuugi
n'omala okulya n'obeera nga togikozesezza obuvu carrying out exercising. Kati that's yensonga lwaki nti cases zino ez'endwadde ezo zetuyise non-communicable diseases zigenze zeeyongera. So far twakalaba emiteeko ng'esatu. Tulabye ku ndwadde za blood pressure ez'emisuwa, netulaba ku ndwadde ez'omutima, kati ne ku bwongo tutuuseeko nga tunyonyola paralysis ne stroke. Kati naye nga mu zonna ze twakalaba, we have not identified a single causing agent nti ka bacteria kawuka bwekati kalese ne
kavudde ku sekamusisi
ne kaleeta obulwadde obwo. So this is a very important part of our health that is under our own control. That is under our own control. You don't need to use a mosquito net. You don't need to use coatem. You don't need even to say that I'm going to wash my hands and prevent.
You said it is under our what?
Our own control.
Our own control.
Yes.
You don't need to use.
You don't need to use a mosquito net. You don't need to use any kind of tablet. You don't need to say that maybe I'm going to wash my hands and prevent myself from getting high blood pressure.
So it's personal social responsibility.
It's a personal social responsibility as you have put it.
Okay, you are still watching Connect with Baliga Afan here at Islamic University in Uganda, Females Campus Kaboja. Remember, all our campuses are still admitting students. You can go to Mbale campus, you can go to Chibuli campus, that's Kampala campus, Arua campus, and here, of course, keeping focus with the IU Females Campus Kaboja. You can come or you can send your results on +256 7047 41369, all the numbers on your screen so that you can be admitted instantly. Here, where we are, we have nursing and this is our skills lab, and you know, when you have professional people in the system, that's what we get. And here with me is Dr.Naziru Rashid, who is the University Medical Officer, and of course you have had the content I'm really surprised, and we are learning a lot.
Exactly. Those people who want to join us, come and learn, please follow what has just told you. Apply online. Admissions are being received. We have our medical school at our Kampala campus.
Habib Medical School.
Medical School. Please join us and you get the best quality of education.
Yes. I think in some.
Yes.
So you were still explaining.
So we have so far seen how those diseases are coming about as a result of our poor eating habit. We said the next risk factor we said is being inactive. It is expected that after eating our food, we should utilize it. Avoid it being deposited in form of fats, as we've just explained. Therefore, a normal human being is expected to do an activity that will make you sweat at least for 30 minutes every day.
Someone can say that me when I eat I sweat.
Do an activity, that is not very strenuous, but an active activity that will make you sweat, and that should be on a daily basis and should not last less than 30 minutes. That is the World Health Organization recommendation in terms of exercise. Once you know that, it is a learning process. You start very slowly, and slowly it becomes part of you. Behavior change. You don't wake up one morning and you say, now I'm going to stop smoking. When you have been smoking for your
it must be a gradual process.
It is a gradual process. So even doing exercise, you take it as a gradual process. You say, maybe for the first 2-3 weeks, I'm going to dedicate 30 minutes for 3 days in a week. Then you can go on adding a day until when it becomes part of you, and you make it a habit that every day, maybe you run for 30 minutes, maybe you jump around for 30 minutes, and you make sure that you sweat. That sweating helps you to remove those excess fats from your body and helps your heart to be very active, that it is used to that kind of harsh condition, such that even when you find yourself in a difficult situation, the heart is already trained to contain that kind of pressure, and therefore it will not strain a lot to any large, like you said,
not being
so on and so
being
forth.
Mumbeja Shazia. Seated there, eh?
Yes.
Okay. So you even talked about you've talked about the inactiveness, and we also talked about the excessive. I've been noting, I'm learning the excessive consumption of alcohol.
Yes. So apart from poor eating and then inactivity, other risk factors we mentioned, excessive consumption of alcohol and smoking. Those two habits, they are one of the leading causes of most of the cancers. Remember, we said we are talking about diseases that cannot be transmitted.
When you say about we
Mm-hmm.
as people, or we lay people, when you talk about the cancers, even overeating brings cancer. I think you're using an English term.
Yes. I didn't want to use other terms like malignancy, like neoplasms and so on.
Thrombokinase.
But what happens is that a number of cancers, like lung cancer, let's be specific, cancers in the esophagus, cancers in the throat, cancers in the different parts of our respiratory system have been attributed to excessive smoking.
Okay.
And as we said, those conditions, they are also on the rise. From the figures and the researches of some scientists, they found that they are actually on the rise compared to other infectious diseases. So that is also behavior. It is you who determines that I should smoke or I should not.
Okay.
So you cannot use the mosquito net to prevent yourself from smoking, or the Ministry of Health will not come and tell you to start washing your hands so that you don't acquire cancers that are due to excessive smoking.
Okay.
The same applies to alcohol.
It's you that puts yourself in the...
Yes. So having known those risk factors, I think it is upon us, ourselves, and maybe our leaders, the policymakers, and us, the health workers, to make sure that we prevent this burden of increasing cases of non-communicable diseases. And there are a number of There are a number of policies, there are a number of activities that can be put in place to make sure that we protect ourselves and our communities from the burden of non-communicable diseases.
Actually, that is very nice. How do you go by that? I mean, you're saying there are a number of things that we can do to prevent ourselves from doing that.
Yes.
Like?
Now, slightly before we look at that, you'll find that the current situation of the lockdown indirectly promotes all those 4 factors that we saw above. Because people are not working, they've been told to stay at home, there'll be a lot of food at their disposal, so they are prone to overeating, and because they are not working, they are prone to being inactive, they are not utilizing the food, so this can actually be a risk. By the time the lockdown ends, people may be suffering or may be at a risk of getting those diseases that you have already seen. That is 1. 2, also because people are at home, they're in the lockdown and they're not working, it also puts them at a risk of increasing the consumption of alcohol and smoking.
Even thinking a lot.
Exactly.
Okay.
That's why this show is actually very, very important, our people, that we needed to warn them that much as they are in the lockdown, they needed to watch their eating habits, they need to watch the fact that they are not active, they should create time to use their bodies so that they don't store excessive nutrients within their bodies. They should make sure that they should not overconsume alcohol and smoke.
Okay.
Yes.
Inshallah. That is good. But are they curable?
Yes.
Do they have a cure?
Yes. Let's go to that point of prevention. And management. So prevention of any form of disease or any condition is not one man's show. It is a multi-sectoral approach, and even these non-communicable diseases, they can be approached at different sectoral levels. For instance, Ministry of Health, stroke government, stroke policymakers, they need to help the community in making sure that they prevent the occurrence of these non-communicable diseases.
I've watched adverts, I've had...
Yes, for example, of all our risk factors that we've talked about, alcohol, smoking, and so on, it is the responsibility of the government, of the Ministry of Health, of the policymakers, to make sure that they reduce the availability of those items on the market. By, number 1, overtaxing them.
I thought
that is 1. By imposing high taxes on such products which are harmful
like
to the
cigarettes
health of our people. That is 1. 2, they should make sure that they restrict advertisement of such products. That people should not over-advertise consuming alcohol.
There's some adverts that actually they're called misleading adverts. Where you see someone pours a drink in the glass and be like, hey, what kind of...
So it is the role of our policymakers.
Okay.
Number 3, they must impose the manufacturers and the sellers of such items to put a health warning on their products.
This is what I hear. Excessive consumption is harmful to your health.
Alcohol is harmful. Cigarette smoking is harmful to your health. That is at a policy making level. Next is to sensitize our community, like we are doing right now, to make them know, make them aware that consumption of such products, alcohol and cigarette smoking, can actually be dangerous to their
lives,
to their health. Also, it is our role as health workers to sensitize the community about good eating habits. That if you are consuming, make sure if you can afford, your meal should not have a lot of carbohydrates, should have a certain percentage of carbohydrates, then you put a fruit, you put vegetables and so on. So that, so that your body gets a variety of nutrients that will be utilized for different purposes. As opposed to over-consuming one particular type of meal, like carbohydrates, yet the body requires a particular percentage of it, and then the rest will be stored. And we have seen the dangers of being stored.
Fats.
So it is stored in the form of fats, and it puts you at a risk of all those conditions. So another way of preventing is that one, sensitizing the public, make sure that they get the right information Also, the government can put in place ways of making sure that the public gets food security, they get the best food that they desire at a particular time, and also educating them. The different departments, the agriculture, the nutritionists should continuously be teaching these people, just like they have done for COVID-19. The energy they've put in hand washing, face masks, if they had put it
social distancing,
if they had put a similar effort in prevention of all other diseases, maybe our burden of diseases wouldn't be the way it is right now, because people have got the right information and have complied, and as a result, we have not reported any single death of COVID-19. There are no community transmissions, just because people got the right information and they implemented it. So we need to do the same even for all other diseases. We give our people the right information and encourage them to implement. Okay. And we shall see a reduction in the number of diseases, including non-communicable diseases. At a personal level, we have so far seen government, then health workers.
No, we need to know
the role of the community. At an individual level, maybe we're already there. So it is our task to make sure that we do regular screening.
You go to the hospital?
Yes.
To check you?
Yes. I'm assuming that you're going to start implementing what we have discussed: good nutrition and exercise and stop smoking and so on and so forth. So you are expected to do regular screening at least once in 6 months or once in a year. You do a screening, what we would call a nutrition assessment. Take your weight. Simple things. They take your weight and your height. They calculate for you what we call body mass index. The body mass index will tell you that you are underweight, you are not eating enough, or it will tell you are within the normal range, or it will tell you that you're becoming overweight. You are not yet sick, you're becoming overweight.
So you should check yourself.
Check. So when you move from that category of being overweight, you go to what we call obesity. Once you're in the category of obesity, you are at a risk of getting another disease called type 2 diabetes, sukari. Type 2 diabetes is also one example.
My friend thought that sukari, go back to get tabula mujid. Nti anywede nnyo sukari. And actually, yayina sister we ngalooza anywede nnyo sukari, kanene ava ku sukari.
Kati sukari oyo, it's glucose. Kaba twalabye glucose ava mu bintu bingi okuviira ddala ku chapati, mu ngano, muceere, muwogo, mayuni, all those carbohydrates, their end product after digestion is glucose. And when you talk of diabetes, we are talking of a glucose disorder. Tulina ebika bibiri. Ekika ekisooka kiri genetic or hereditary, nti omuntu asobola okuzaalibwa ng'alina that type, obanga ali ku risk y'okufuna obulwadde obwa sukali okuva mu bazadde be, kye tuyita type 1 diabetes.
Type 1, eh?
Yes.
Okay.
Kati eno type 2 diabetes, which is important for our today's show, yo tozaalibwa nayo, ogifuna bufunyi kuva ku lifestyle yo.
Social life.
Exactly. That is, maybe that can be a topic for another day.
Yeah, true.
But for today, your body is reaches a particular time when it is no longer sensitive to insulin and to glucose, so it does not consume the glucose that is in your body than it would. Therefore, it remains in your circulation. Yes, and that is what puts you at that risk is being obese. Okay. What puts you at being obese is being overweight, which results from poor eating habits.
Is it possible that everyone I see who is fat is obese?
No. No, it's not obese. That body mass index I talked about, it is the one which qualifies us. We have figures that I take your weight vis-a-vis your height. A particular range of height, you are expected not to exceed a particular weight. A particular range of height vis-a-vis your weight. So once you take your weight and your height, we calculate your BMI. So after calculating your BMI, which is body mass index, then it categorizes you into underweight, normal weight, overweight, then obese.
Oh.
So it depends on your height vis-a-vis your weight.
Okay, I understand.
Exactly, yes.
Okay.
So not everyone who is fat is obese.
Someone can be fat in their own...
But when he's tall, and that is the normal weight for his height.
Okay.
Something like that. Yes.
I understand that.
So we are saying prevention and what should someone do. So when you do regular checkups for weight, height, blood sugars, blood pressure, it gives you a picture of your standing, and then you know what to do. So themselves will tell you, according to this, you're almost crossing from this to this. You're almost crossing from normal weight to overweight. So please check on your diet, increase on your exercise, and so forth and so forth. If you are not screening, you may not know. You find when you're already there.
Okay.
So that is the importance of regular screening. Secondly, when you come for screening and we find out that you have already reached a stage where you need to maybe start on medication, then we start you on medications for diabetes or medications for high blood pressure and so on and so forth accordingly, and then we advise on what lifestyles are you supposed to change. In other words, the last approach should be that one of the doctors. But the first approach should be the policymakers, then the community, then you, the individual, and the hospital should be actually the last opportunity, the last alternative, which wouldn't advise you to wait and reach that level.
So you'd rather go before it becomes the worst?
Before it becomes late, yes. Also, it is the role of the government to make sure that our health workers are informed about those diseases, irrespective of the cadre, be it a nurse, a midwife, or a doctor, or a clinical officer, so that they can help our community. As you know that we have districts or places where the highest ranking health officer in that area is a nurse. So we all need the same information because our communities have the same problems. Okay. That is one. Two, still it is the government to make sure that there is availability of medications.
In those hospitals?
Everywhere, such that when we find out that you've already crossed that particular level, we need to help you not to go into a more severe state. So once we identify the problem, when it is still early, we can help you not to go into a more severe state. Also, is make sure that the test kits are available in all facilities. That when you come and the doctor or the nurse or the lab technician feels like you need to check your blood sugars, should be in position to have the test kit for blood sugars. When he feels that you need to check for your blood pressure, should be in position to have a blood pressure machine to check you, and so on and so forth. Why? Because if you are really a candidate for blood pressure and you go back home when it is not checked, you'll not have been helped, and it will develop into severe forms and it will affect you, and this will affect the country. Actually, it comes back because you are going to reduce on your time of work, which will affect the economy. So it has an indirect effect.
If you die, you're not going to pay tax.
You are not going to pay tax. You may die prematurely, and this will also reduce on the number of your productivity, and so on and so forth. So it is a vicious cycle.
If you are supposed to give us 10 kids, you will end on 2.
Yes, even the Ummah will lose.
Okay. Anyway, I have a burning question, and it's about the use of herbal and this modern medicine of yours. How do you relate that?
Yeah.
I think you will detail it next time, but I just want a brief answer.
It is indeed a burden question, as you put it. But what I can say, I believe there are herbal medicines that work, but I also believe that there are herbal medicines where people who make them, they get these medicine from pharmacies, they crush them and mix them in their drugs. From my experience, what I've seen so far, a biggest percentage of people who come in severe conditions, when you're interacting with such patients, especially for diabetes and high blood pressure, when you're in a busy center like Mlago Emergency Department and you are receiving cases, the most severe cases, they will tell you when you try to inquire, how long have you had this disease? They may tell you 2, 3, or 4 years. Have you been swallowing your medicine? They tell you, no, I stopped maybe after 3 months, but I've been using my herbal medicine. Meaning that the biggest percentage, I don't have the figures because I've not done a research, but I've observed, they'll tell you they've been using herbal medication. So they end up coming in severe state.
Okay.
Yes, but I don't refute the fact that there may be herbal medicines that actually do work, because even these modern medicines are made from plants.
Okay. You're still watching Connect to Baligia Afan, and the doctor is going to wrap up. We are going to have him next week, inshallah, in another session.
Inshallah.
And of course, we are going to be talking about very many things that we all need to understand. Doctor, I would like you to wrap up with this topic so that we...
Okay, thank you very much, our viewers, Mr. Afan. Today we've been looking at uncommunicable diseases. As we said, that it has not been given much attention that it desires, but it is actually rapidly growing, and its burden is rapidly increasing, and it is as simple as self-moderating your behaviors. You self-moderate your behaviors by making sure that you eat well, you do exercise, and you don't engage in risky behaviors, particularly smoking and alcohol consumption. So once you do all the above, and then you add your social distancing, your hand washing, putting on a face mask in public, you'll have a healthy life. You'll be in a position to go and make your money, reproduce, and bring us children.
That really can impress a girl child to be in an environment where she can really read her books very well and settle.
And do exercise.
And do exercise. We have swimming pool, we have gym.
The environment favors you to prevent uncommunicable diseases.
You are right, doctor.
Yes.
Actually, even here, I told you have nursing. Diploma direct, diploma extension, certificate in nursing and midwifery, diploma in midwifery direct, diploma in midwifery extension. You can also go, if you want to do bachelor's in nursing, you have it at Kampala campus. At Abibo Medical School, we have even bachelor's of medicine and surgery at Kampala campus.
That's bachelor's of biomedical sciences.
Yes.
At our Habib Medical School.
Habib Medical School.
At
Kampala campus. So, in case you want to get any information about any campus, you can go and visit the females campus. You ask about Mbale campus, go to Mbale campus, ask about Kampala campus. Anywhere you can be admitted for as long as you come and have a piece of us. Thank you so much. Pilau, MC Pilau was on camera and is our main producer. Thank you so much, Doctor. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Thank you to hosting.
Okay.